So if you were going to boil this down to the basic treatment for MMA, it is a protein-restricted diet and carnitine.
Treating MMA has been the primary objective for researchers. Although there is no cure as of yet, there are some treatments in existence that ease the symptoms of MMA.
When methylmalonic acidemia was first recognized and the related condition propionic acidemia in the 1960s, the patients were treated with a low-protein diet. And the reason that is done is because it has been learned over the decades that the source of the organic acids that build up in the patient's blood, urine, and spinal fluid and tissues comes largely from amino acids in the diet. Specifically, valine and isoleucine are probably the ones that contribute more than other amino acids. So the approach is rather primitive, which is to just restrict the total amount of protein a patient takes in. And by doing that, you will reduce the load of metabolites because any excess amino acid that a patient takes in, specifically valine or isoleucine, that they don't need for growth, must be metabolized. And when it is metabolized, it turns into methylmalonic acid. So protein restriction was used very, very early on. It still is the mainstay of treatment to this day.
Those with MMA have trouble with breaking down the amino acids isoleucine, valine, methionine, and threonine. Therefore, the aim of treatment is to get the patient to have enough protein for normal development and growth.
Over the decades, another medicine has been given to patients called carnitine, and carnitine has an effect, a presumed effect, with the detoxification of a form of these organic acids that build up in the mitochondria. So carnitine is given to many patients.
Nutritional management is a must for MMA. However, there aren't clear guidelines. Patients should have a low-protein diet. Some patients are prescribed a daily synthetic protein intake, which contains amino acids, vitamins, and minerals, taken throughout the day several times, given in either the form of a gel, drink, or formula. Foods that are naturally low in protein should be allowed freely, for example, most fruits and vegetables. There are also specifically made low-protein foods like bread, pasta, cereal, and milk that can be prescribed and ordered from pharmacies.
There's something called medical foods, which is a separate discussion about a special types of formulas that the children are prescribed, the infants and children are prescribed. And that's a separate topic about medical foods. Medical foods, when they are prescribed in high amounts, can have serious side effects. Not all patients around the world receive medical foods. There's a lot of debate about medical foods in MMA, but medical foods are used in many centers to treat the patients.
In general, high-protein foods, milk and dairy products, meat and poultry, fish, eggs, dried beans and legumes, nuts, and peanut butter are to be limited or avoided since they are usually too high in valine, methionine, threonine, and isoleucine. Depending on the patient's tolerance for these, they may be included in small amounts, but that should be discussed with your doctor.
The other thing that is intermittently given to the patients, and again, every patient seems to be unique, but there are other medicines that are sometimes given to help patients with ammonia control. There are some patients receive antibiotics, and the reason patients receive antibiotics is because one of the other sources of the organic acids that are found in the blood in the bodies of the patients come from the gut bacteria. And what one does with antibiotics is to try to eliminate those gut bacteria so that they don't produce the toxic compounds. And when this is done, it probably lowers the metabolites by as much as 30%. So antibiotics are given, but again, not every patient receives antibiotics.
Antibiotics have side effects which vary between patients, so more study is needed. Patients should also avoid fasting or undergoing long periods of time without fluids or calories. Some patients need a feeding tube, but it varies on case-by-case basis. If the patient has vitamin B12 responsive MMA, then they can get intramuscular injections of vitamin B12. However, there are other types that are not responsive to vitamin B12, like MUT0 and MUT-.
The treatment of MMA, it's more management because the condition is not treatable by conventional methods. So what we do to treat the patients is to treat their symptoms when they have them, or treat them so that we block them from getting problems with organs we know can be affected by MMA, like the kidney.
Patients' kidneys have to work overtime to remove the waste buildup in their bodies. As a result, their kidneys can start to slow down or not work as well, hence the need for a new kidney. The donor of the kidney can be a parent or relative if it's a match. Besides the kidneys, the liver has a central role in the body's metabolic processes. Liver transplants and combined liver-kidney transplants have been used in cases where patients had frequent metabolic decompensation and needed more than just a low-protein diet and medications, mostly in patients with isolated MMA. Those with isolated MMA are largely non-responsive to vitamin B12. From either a living donor or elsewhere, there is the option of liver transplants. After a transplant, the patient must take medicines their whole life to prevent organ rejection. Overall, there are many treatments for MMA, and hopefully in the future, there will be a cure.